Local health officials are raising concern about a fast-spreading coronavirus subvariant that's driving up COVID cases ahead of the huge crowds expected to gather here in San Diego this weekend and next. Good afternoon. We made it to Friday. Thanks so much for starting your weekend with us. Welcome to The Floor. I'm Marcella Lee. Heather Myers has the day off.
I'm Carlo Cicchetto. That new variant is called BA.5, and it accounts for 65% of all new cases in the U.S. And with cases rising quickly, some experts are asking people to mask up once again.
CBS 8's Kelly Hessedal is live along the waterfront today with what a county doctor is saying. Kelly?
That's right, and the CDC just moved San Diego into the high-risk category due to the number of cases here, as well as the number of people admitted to the hospital. Now, the doctor with the county that I spoke to today says if you're headed to Pride this weekend, bring your mask.
Certainly, if you're going to be in a crowd, no matter what event you happen to be attending, it probably wouldn't be a bad idea because, folks move around. People can be in tight spots for periods of time. And even though you're outdoors and the risk is less, especially because you've got more air there, large crowds can be a risk no matter where you are.
And let's be clear, there is no mask mandate in place in San Diego County, but this latest variant is believed to be more contagious than any of the other ones, and it's spreading fast. According to Dr. Kaiser, whom you just heard from, the amount of COVID virus in wastewater samples is double right now compared to what we saw during the Delta surge last year. Now, 3/4 of what's being detected is the Omicron subvariants, BA.4 and BA.5. Add to that big events like Pride and Comic-Con, and health officials are worried that the number of cases will climb a lot higher. Now, countywide, we're currently at around 400 patients admitted to the hospital with COVID. About 40 are in the intensive care unit. Now, the age range is anywhere from teenagers to people in their 90s. And yes, some of the older folks have underlying conditions, but some of these patients don't.
Even though it's certainly true that the older you are, the more likely you are to be affected by it, we've had deaths and hospitalizations from people down sometimes in their 20s. Don't think that just because you're young, the virus might spare you too.
And his message today was get vaccinated. If you are eligible for that second booster shot, go ahead and get that as well. It's proven that getting the vaccine cuts down on your chances of getting severely sick or admitted to the hospital by at least 50%. Marcella and Carlo?
And Kelly, we're talking about large groups of people, a rise in COVID cases. We're talking about using masks once again. But what about home tests before you go out? Do they recommend taking that step? Can that help?
Well, I think they always will recommend that testing is a good idea. However, rapid tests aren't always accurate. You may test negative one day and then test positive the next. They aren't quite as sensitive as those PCR tests. However, the bottom line is if you have any COVID-like symptoms, doctors are saying you should really stay home.
Some good advice and just extra caution before everyone gets out this weekend. We want to have fun, but we also want to stay safe. Thanks so much, Kelly. Have a great weekend.